Hey guys, good afternoon. Today I'm going to do part 2 of what changed in outpatient care, what patients feel but can't name. Today is the refill button isn't simple. He's mad at me. I want to continue where I left off in the last video. And again, I want to be very clear at the beginning. None of this is about blaming anyone. Not nurses, not medical assistants, and not physicians. Most people working in healthcare are doing the best they can inside the systems that they're working in. This is about something else. Today, I want to talk about something that sounds small, but actually carries a lot more complexity than people realize. Medication refills. Or more specifically, what people think a refill request is versus what it actually is in real clinical care. On the surface, it seems simple. A patient requests a refill, someone clicks approve, and the prescription is sent. Do you disagree? But in reality, that moment can involve a lot more clinical thinking than people see. Because a refill is not just a button, it's a decision point. There are questions that ideally get asked, sometimes quickly, sometimes in depth. Is this medication still appropriate for this patient? Has anything changed since it was first prescribed? Are there labs that need to be checked? Is the timing of the refill correct? Is the dosage still safe based on age, weight, their kidney function, or the other medications they're being prescribed? Is this something that should actually be refilled or maybe reassessed? And sometimes there's context that doesn't show up in the chart in a clear way. A message from a patient saying they're still in pain. A note that got buried. A change in symptoms that doesn't trigger an alert. Or sometimes no context at all, just a request in a queue. And what I've noticed, both as a nurse and as a patient, is that this is one of those areas where systems can become very dependent on templates, protocols, or quick approvals, because the volume is high and time is limited. Efficiency matters, and I understand that. But the concern is that when a process becomes too automated or too separated from clinical judgment at the point of action, nuance can get lost. And in medication management, nuance matters. I've seen situations where a refill is routine and appropriate, and I've also seen situations where a refill request is actually the first sign that something is changing with a patient, but may not get recognized in the moment it's processed. Not because someone is careless, but because the system doesn't always highlight what needs a second look. Did you have something to add? No? Okay. And this is where nursing judgment, used to play a very active role in many outpatient settings. Not just clicking approve or deny, but asking, does this make sense for this patient right now? Because a refill isn't just a continuation of a medication, it's continuation of the clinical story. And if part of that story changes, but the workflow doesn't surface, then the care can continue without the full picture. So when I talk about changes in outpatient care, this is what I mean. Not that people aren't doing their jobs, but that sometimes the job itself is structured in a way where clinical context becomes harder to see in the moment decisions are being made. And this is where I want to go next. Because if refills are one place where decisions quietly happen in the background, then the next question is even more direct. Who actually decides when a patient needs to be seen? Because in many cases, that decision isn't as clear or as visible as people think. And that's what I want to talk about next. We all need to remember the human in healthcare. Just a nurse writing from a patient's chair. And Maverick. Nothing to add? No? We'll see you again tomorrow. Thank you for listening.